about the last time you took your child to the doctor and took home a prescription for antibiotics. Well, according to a new study, 1 in 3 antibiotics prescribed in the U.S. are actually unnecessary. Now, pressure to prescribe is something that doctors face on a regular basis. And joining us now in tonight's Caring for Our Kids to talk more about what this could really mean for you, we have Dr. Katy Stordahl from Children's Hospital. Always good to see you.
Thank you.
Let's talk a little bit about why doctors actually prescribe antibiotics in the right cases. Why are they prescribed?
Antibiotics only treat bacterial infections, and most infections that we see, particularly in pediatrics, are viral, meaning that antibiotics don't work. Where the confusion comes in is that there's been a traditional history in America of prescribing, even for upper respiratory infections or colds, trying to prevent a bacterial infection. Well, we know now that that doesn't work, but because that's so ingrained into our culture, many people come in expecting their doctor to give them a prescription for their child every time.
Many people almost ask for them. I've heard parents say, I want an antibiotic, but there are dangers of getting prescribed one if you don't really need it, right?
There really are. One of the most common adverse effects that we see from a medication that comes into the emergency department is from an antibiotic. We see children coming in with abdominal pain, vomiting, diarrhea that they can be dehydrated from. They can have rashes, and then there are the more severe effects that we worry about, like anaphylaxis, which is a life-threatening allergic reaction, or Stevens-Johnson syndrome, which is also life-threatening. So we don't want to prescribe antibiotics unless we truly believe that they're necessary.
Is it true that you can become antibiotic resistant, so to speak, so then when you really do need them, they're not going to work the way they should?
That's true, and it works on a population basis. So because in the U.S. and across the world we have traditionally overprescribed antibiotics, we are starting to see various bacteria that no longer respond to traditional antibiotics. A very good example of that is what MRSA, most people know of, that causes abscesses and skin infections. In the past, that type of staph responded easily to Keflex or amoxicillin. Now we've had to change the type of antibiotic that we use, and in many cases we have to use 2 different antibiotics to try to treat it.
So people really need to keep that in mind when they're almost begging their doctor for an antibiotic. But we don't want to send the message that if you think your child has a virus, to not go to the doctor, right?
Right, because only the doctor can determine that. And many things that are viruses, such as a cold, if they continue for prolonged periods and the child is still having fevers, that can mean that that child has developed a secondary bacterial infection, such as a pneumonia or such as an ear infection that may need to be treated. So that's why we say it's still important to see your doctor, because only he or she can make that determination.
Dr. Stordahl, some valuable information really that every family out there needs to hear tonight. Thank you so much for coming in.